We are back. Part 2 of fluid, electrolytes, and acid base. This is Dr. DeShavo. If you have any questions, by all means, shoot me an email. Electrolytes, charge it up. So electrolytes are ions, okay? And ions are charged particles. A cation is a positively charged electrolyte or ion. You can use them interchangeably. Anion is a negatively charged electrolyte. Don't get nervous. We're not going to get a ton into them. We have a few basic ones that are important that I'll ask you to know, and then we'll move on. It's not going to be a chemistry review, I promise. Now, it's important to know these basic cations and anions because they play a role in muscle and neural activity. Sodium and potassium are the two big ones when we're talking about muscle and neural activity, as well as calcium. Those three charged particles, and I have a list on the next slide, help to make muscles and nerves work. We're going to go over this a couple times. So sodium, potassium, and calcium help to make muscles and nerves work. So just like kind of wax on, wax off kind of stuff, get that into your head because we're going to go over it in the future. Now, acid base, you probably know some of the ions, and if you don't, that is just fine. One that's easy peasy is bicarbonate. Bicarbonate is actually an ion which makes us more alkalytic. It'll actually tie up acids in the body, making them inactive in our tissues, and causes a decrease in the acidity of the body. Hydrogen ions. Easy, right? That should be like hydrochloric acid. Hydrogen ions contribute towards the acidic part of our acid base. And the final main one that we're going to talk about, this is all in the future, so don't be stressing out writing this down, I've got it right in the notes, is carbon dioxide. And you already know where that comes from. That comes from the lungs. Okay, so we're going to get into these. So looking at some of these on the next slide. Sodium, potassium, calcium. Big ones. You know, really earmark those in your brain. Of course, chloride is important as well. And we'll get into that very little bit, okay? Phosphorus is important actually to help put calcium into your bones. Magnesium helps put calcium in your bones. If you have really high levels of phosphorus, though, abnormally high, off that level that we see to the right there, and these are your normal ranges, you can actually leach calcium out of the bones. And we get a lot of phosphorus when we drink a lot of soda. So just a side note, okay? So here's the list. I'm not a laundry list kind of gal. I really like giving them to you with what they do, so hopefully it's a little easier to remember. But once again, here's the list with normal values, just so you have them. Now, I want to very, very little talk about ions in and out of cells, because as I said, this will actually apply when we talk about nerve and muscle function in the future. So once again, this is kind of wax on, wax off. Why am I doing this? If you have no idea what I'm referencing, it's Karate Kid. Anyway, so you don't need to understand these concepts completely. I'm giving you the basics so we have a good reference in the future. So ions around and in the cells. So this is referencing a normal everyday cell, okay? And when we get into muscles and nerves, we'll use these concepts again. So if this little segment of the cell were cut out and we blow it up, I'm sorry, one of the videos I had prepared for you just turned on. If we, all right, pull that little segment out and blow it up. Right now we're looking at the cell membrane, okay? This is intracellular fluid and ions. This is extracellular fluid, ions, and water, okay? Now, we like to keep more sodium or a higher concentration of sodium in our extracellular fluid, okay? Why? We'll get into that in just a minute. We also, so sodium outside the cell. That's what you should earmark in your head. It's at a higher concentration. Do we have sodium on the inside of the cell? Sure we do. It's here. But it's at a higher concentration outside of the cell. Okay? Now, potassium. We like to keep at a higher concentration inside the cell. Do we have it outside the cell? We sure do. Okay? But it's at a higher concentration inside the cell. And this is a normal resting cell. Okay? Now, guess who likes to leak out? Okay? Potassium likes to come to specific channels for potassium and sneak out, just like the naughty kids breaking curfew. Guess who likes to sneak in? Through specific sodium channels. Sodium, I just gave it away. Sodium sneaks in. That's just what happens in a resting cell. These cells don't stay stagnant. They have things coming in and out all the time. Okay? So, as sodium sneaks in and potassium sneaks out, it'll begin to create an imbalance where we're having too much potassium out and too much sodium in. This is just a resting cell. Okay? So what happens is we have specific pumps that rebalance those ion concentrations. And the best one that we will talk about, actually the only one we will talk about, is sodium-potassium pump. And it does exactly that. It pumps sodiums and it pumps potassiums back where they should be. So here we are looking at a cell membrane with a very specific protein channel. So we have specific protein channels for different ions and substances. We have specific channels for sodium. We have specific channels for potassium. But we also have one for sodium and potassium together. And this is the sodium-potassium pump. Okay? So here's that protein channel in the membrane. This is inside the cell. This is outside the cell. And sneaky little sodium, which should be at a higher concentration outside the cell, is in the cell. And sneaky potassium, which should be inside the cell, has snuck out because they're naughty kids breaking curfew. So when the levels get too high of the sodium sneaking in and the potassium sneaking out, sodium-potassium pump kicks in. And what will happen is we bind 3 sodium to these receptors here. And you could see these 3 sodium then get transported out, reestablishing where they should be. 2 potassium actually attach to receptors and get pumped back in. Okay? Now, the other thing that we should note is that we're pumping out 3 positive ions and we're pumping in 2, this drives me nuts. Let me see if I could just switch slides. Okay, and then we pump in 2 positive ions. Now, the reason I'm going over that is if I go back a slide, it's giving me a little hassle here, I apologize. There we go. Okay, if I go back to this picture, okay, don't forget, sodium is a positive ion. Potassium, which is K+, is a positive ion. Sodium is Na+. Now, in addition to have those positive ions, we also have negative. Chloride is negative, and inside the cell we have negative proteins. So what happens when we pump 3 sodium out and 2 potassium in, the cell becomes negatively charged. Oh, I know that's mind-boggling. Okay, so because we're pumping 3 positive ions out and only 2 in, relatively speaking, the cell becomes more negatively charged. You're like, who cares? Let me tell you why. I'm establishing the basis for the action potential, which is what makes muscles and nerves work. So, okay, so if you have the very basics of that, when we get to it, it's going to be way easier. Okay, so the things to remember, we pump 3 positive sodium ions out, 2 positive potassium in, creating a negative environment for that cell, because don't forget we have negatively charged particles inside and out the cell too. If we have a resting cell in the muscle or the nervous system, it's usually, if you were to put 2 little electrodes in there and measure it, about negative 70 millivolts, believe it or not. Okay, and that's what a resting cell is. Woo, that's a chunk of change. If you need help or explanation with that, please let me know. Now, talking about ions, your book went crazy with this. I pared it way down. Okay, so sodium, this is going to be the most significant cation or positively charged ion, okay, that will help with the balance of fluids in the body. It also will help muscles and nerves work, as I spoke about. Hypernatremia is obviously going to be above 145 milliequivalents per liter. Serum osmolarity or concentration, that's all that means, increases. Fluids will shift to where sodium is, or you'll retain fluid. We could also have a deficiency in water, and pretty much all of those are pretty self-explanatory. The diabetes insipidus we spoke about before, we're going to dump water through the kidneys because we don't have enough ADH. An excessive sodium intake or ingestion or hypertonic solution. We also have Cushing's syndrome, which is an inappropriate release of hormones that go to the adrenal cortex. We'll get into that when we get into endocrine. So this also increases cortisol, which retains sodium. Hypernatremia will present as increased thirst, possibly seizures. Don't forget, sodium helps muscles and nerves work. If you have a truly huge excess of sodium, you could facilitate stimulation in your nervous system, such as in the brain. Coma, because we aren't going to have a good functioning nervous system and response, and obviously edema, because we'll retain fluid. You got this. Answer the question. I'll see you in the next slide. Hyponatremia is going to be below 135 milliequivalents per liter. Serum osmolarity or concentration decreases because we have too little salt. So deficiency in sodium, diuretic use. Obviously, most of you would know that. GI losses, excessive sweating, dietary sodium restrictions, hypotonic saline. I'm buzzing through these because I think these all make sense. Excessive water ingestion or syndrome of inappropriate ADH, which we spoke about earlier. Hyponatremia, diminished deep tendon reflexes, muscle weakness, seizures, and coma, because once again you need that sodium to allow your muscles to function properly. Chloride, I have one slide about. There's your range. It's a mineral electrolyte. What I want you to remember about chloride is the major extracellular anion, which means negatively charged ion. And that, I think, is easy to remember because sodium chloride is salt. We ingest sodium chloride. Sodium and chloride stay on the outside of cells at a higher concentration because they actually have a little bit of attraction to each other. Hyponatremia will cause changes in muscular function. True or false? Now, potassium is the primary intracellular ion, that's the K+ that we spoke about. It plays a role in electrical conduction or functioning of muscles and nerves, as we spoke about. Now, hyperkalemia and hypokalemia can cause muscle weakness, both of them, dysrhythmias, hyporeflexia, and EKG or ECG changes. If we look at an ECG here, you can see, I won't ask you to remember the exact response with the ECG, but you can see the QRS complex is not quite as elevated and it is slightly longer than normal. Excuse me. Tall T wave, prolonged PR interval. There's a lot of things that can go wrong. Hypokalemia also has effects, and once again, you don't need to remember the exact effects. Just remember that either one can cause changes in heart rhythm and EKG findings, excuse me. All right, another question time. The heart can have dysrhythmias with which of the following ionic changes? I'll let you look through that. You can answer that, and then we will move on. Calcium. Okay, so we know calcium is important for bones and teeth, but the bones are also a storage house for calcium because we need to have a certain amount of calcium in our bloodstream to help nerves and muscles function. So what will happen is if we don't have enough calcium in our diet, we'll break down our bones, leading to osteoporosis, so we can make nerves and muscles function. Not that bones aren't important, but your body's making a choice here. It's saying, okay, I really need to function with my nerves and my muscles, so I'm going to suck calcium out of my bones so I can use calcium for muscle and nerve function. Calcium binds with phosphorus to get into the bones, but too much phosphorus can actually, if your levels go above normal, I should say, it can actually leach the calcium out of the bones. Calcium also needs magnesium to be absorbed into the bones itself. So we need vitamin D, some of you have probably learned that in the past, to draw calcium out of the intestines. We need magnesium and phosphorus in order to put calcium into the bones. So we have different functionings for those supplements and or minerals. Dietary intake, you could get this also from spinach, you could get it from broccoli, you can get it from other things other than dairy as well. They have great almond milk now, that's where I get most of mine from. Vitamin D, as I just mentioned, helps absorption from the intestines. And it's regulated by two hormones, and one is called parathyroid hormone. And parathyroid glands are little glands on the back of your thyroid. If you can picture your thyroid like a little butterfly, on the back of it we have 4 to 6 small round structures that are the parathyroid glands. And parathyroid glands release parathyroid hormone, or parathormone, some people call it, and that will pull calcium out of the bones so we can use it for muscle and nerve function. Calcitonin is a hormone that will be released from the thyroid that helps to put calcium into the bones. There has been some controversy with this. There's been some studies saying that it actually does not put any calcium into the bones. Your book has it. I've used it in the past. So calcitonin, I always used to say this, puts it in the bone-in, if it helps you to remember. Okay, so calcitonin comes from the thyroid. We will talk about that again. Now, hypercalcemia. This will be increased calcium levels in the bloodstream. When you have high levels, you can have dysrhythmias, ECG changes, decreased deep tendon reflexes. You can get this from taking too many antacids, but really, I think you're going to more see it with hyperparathyroidism. So if there is disease with those parathyroid glands, they'll release too much parathyroid hormone, which will draw too much calcium from your bones into your bloodstream. Hypocalcemia is obviously, a low level of calcium. You can get this from hypoparathyroidism. So you're not releasing enough of that parathyroid hormone to break down the bone and get calcium into your bloodstream, or you're not ingesting enough calcium in your diet. This can also cause dysrhythmias, ECG changes, muscle spasms, seizures, increased deep tendon reflexes with hypocalcemia. Now, two of the things that your book have listed as tests that you can do in your office to test for this hypocalcemia is positive Trousseau's, where you put actually a blood pressure cuff around the bicipital region, you inflate it, and after 3 minutes or less, the hand will spasm in towards itself, almost like a little duck beak kind of position. And in your supplemental media, I have a video of that positive Trousseau's. Trousseau's sign is when you tap the facial nerve, the patient will have a little facial spasm. Your book's picture is very exaggerated, so make sure that you watch the video that I've given you in your supplemental media so you can see a positive sign. It's much more subtle. I also, as a side note, put in a video about the sodium-potassium pump for you, so you can review that in a different way, and hopefully it'll help to clarify any questions you might have. Let's practice a little bit. Calcium and patient tests. The one last thing, I'm sorry if I just back up, hypocalcemia can do is it can increase deep tendon reflexes. There are several deep tendon reflexes, I hope you remember. We have them in the biceps tendon or bicipital tendon, brachioradialis tendon, triceps tendon, patellar tendon, which everyone is, that's actually in the ligament, but that's a different conversation. Everyone knows that. Behind the ankle, we have one, and also the hamstrings, the medial hamstrings. So if you were to go in and test those reflexes, there would be an increased response. That might be a little hard to elicit, especially since they might be bilaterally the same, because that patient has a systemic problem with their calcium levels. Now let's practice. So this is going to be a test of the deep tendon reflexes. And you can see, just as a quick review, this is the biceps. This is called brachioradialis. Here's your patellar ligament. Here's the Achilles. Here is your triceps. This is trying to elicit almost like a similar response like a Babinski. But anyway, if you strongly dorsiflex someone's foot who has issues either with hypocalcemia or an upper motor neuron lesion where they have had either a stroke or spinal cord trauma, if you quickly bring their foot back, it actually will repetitively tick forward. Anyway, that's for a different conversation. So these are your deep tendon reflexes, and there is actually at least one more, but okay. So there's those. Oh, this is a little hard to tell because I know you haven't seen it yet, but this one's Trousseau's sign. Excuse me. If you were to put a blood pressure cuff on the bicipital region, their hand will move into that forward flexed position. Now this one, what do you think represents? Chopstick sign. Yep. So it's not quite this obvious. Make sure you review the videos, excuse me, so you can get a better understanding of those. Okay, so we're moving into acid-base balance. And I'm going to begin acid-base balance in the next video because it's a fairly long lecture. And if you have any questions, of course, let me know, and I'll see you in the next video.